Hi ladies, how are you doing? I hope everyone is doing good. If you are watching this, it probably means you or someone you love has been through a loss that words cannot quite describe. A miscarriage is not just a medical event, it's a heartbreak, it's confusion, it's guilt, it's silence. And far too often we are told it was because we were too stressed, too active, too sad, too excited, or blah blah blah. Let me start by saying this clearly: you did not cause your miscarriage. No one wants miscarriage, right? So let's talk the fact. About 80% of miscarriages happen in the first 12 weeks, and in most cases there was absolutely nothing you could have done to prevent it. The number one cause of miscarriage is, especially in the first trimester, chromosomal abnormality is the reason. What does that mean? Everybody gets 23 chromosomes from the egg and 23 from the sperm, but sometimes something goes wrong during cell division. A chromosome might be missing, duplicated, or in the wrong order. These errors are completely random, nature's way of protecting you from a pregnancy that would have been survived. Miscarriage is not a failure of the body, it's a defense mechanism of nature. Here are other common medical reasons that can lead to miscarriage. Again, most are not caused by your behavior. Number one, genetic condition in the embryo. Sometimes both parents carry genes that, when combined, cause the embryo to be non-viable. Number two, uterine abnormalities. Conditions like septate uterus, fibroids, or scar tissue can interfere with implantation or growth. Number three, hormonal imbalance. Low progesterone, thyroid disorder, or PCOS can affect the uterine lining and early pregnancy. Number 5, blood clotting disorder. Condition like antiphospholipid syndrome can increase miscarriage risk, but they are manageable, and with treatment, once it is diagnosed, it can be cured. Number 6, maternal age. As we age, the quality of our egg declines and the chances of chromosomal errors increase, especially after age 35. What about lifestyle? Yes, extreme alcohol, smoking, or drug use can increase miscarriage risk, but occasional coffee, walking too much, lifting something light, or crying after a bad day, none of that cause miscarriage. Believe me, none of that cause miscarriage. I have been there. I remember lying in the ultrasound room, the silence that came before the doctor said, "I am sorry, there is no heartbeat." The days after were filled with self-blame. Did I cause this? Was it the stairs I climbed? Was it the argument I had? I went over every detail, every meal, every movement until I learned the truth. There was never anything I did wrong, and neither did you. Please believe me. It took time, therapy, support, and science, and eventually I understood my body did not fail me. It protected me from future pain. Today I share my story so no one has to feel that silent shame ever again. If you have had a miscarriage, take time to grieve. It's a loss and it deserves space. But also know this: most women who miscarry go on to have a healthy pregnancy. Everybody will have a healthy pregnancy if they have miscarried in their past. There is nothing wrong in it. If you have had 2 or more miscarriages in a row, talk to your doctor about recurrent pregnancy loss workup. You may be tested for hormonal issues, autoimmune disorder, clotting problems, or genetic compatibility with your partner. So, what we can do in this case? We should see a reproductive endocrinologist if it is concerned. We can track our cycle and ovulation. We can consider genetic counseling if needed. Take a prenatal or folic acid. We can prioritize mental and emotional healing too. So, miscarriage is not your fault, it's not a punishment, it's not because you did not wish hard enough. It's a biology, it's a nature, and sometimes it's just devastatingly random. But you are not alone, you are not broken, and you are not to blame. Speak your truth, share your pain, and know that healing is possible because your story is not over, not even close. So lastly, I want to say you guys that share your story in the comments. Your words could help someone else feel less alone. And subscribe for more fertility support, science, and honest conversation with me. Thank you.